Ipsis, Kuchihama Miwu, Kanyasis, Albert Titman, Tumale Nisanan Miwak, Maidu, Pit River, and my mother is descended from what they call Mexico. It's definitely an honor to be on with our Telewell relatives here. We have Jeff Springer and Jerry Shea. You'd like to introduce yourself?
Hi, I'm Jerry Shea. I'm a licensed clinical social worker. I have Cherokee, Apache, and Comanche blood, and it's an honor to be here to present with my friends, my brothers.
Hi, I'm Jeff Springer, and I'm here to learn. So it's a pleasure to be here.
Jeff actually is the brains behind all the technical support at Telewell Indian Health at our MAP program. And so thank you, Jeff.
Oh, thank you.
Thank you.
Learned a lot from you in terms of the technical support.
Yeah.
Welcome to our presentation today. It's the Native American Substance Use Disorder Treatment Modalities, and specifically here at our Telewell Indian MAP program, we're going to discuss a little bit about the approaches we're going to be using in our vision for our MAP program. Next slide, please.
Oops.
Some of the culturally based modalities we'll take a look at today include outpatient, intensive outpatient programming, residential / inpatient treatment programs, transitional and sober living, and some integrated approaches towards culturally based modalities. Why is cultural competence important? Well, if we can't relate to the basic beliefs and social construct of our clients, we cannot connect with them meaningful program that they can relate to. And many people leave programs because it does not speak to the core of their cultural values and experiences.
And what I'd like to add there is the client may not even know why it's not working for them. So it's up to us as providers to be sensitive, to really look with an honest eye at what we're presenting. And by tweaking the program to be more culturally sensitive, people might feel more comfortable. That person might feel more comfortable. They may not even know what it is or why it's not working for them.
You know, in our previous webinars, we addressed some of the data, especially around opioid use disorders, some of the barriers. We addressed stigma. And so today we're going to talk more about the modalities. But we felt it was important to consider some of the cultural barriers or the importance of some of the things that we're going to talk about. Respect being one of them, and respect being at the heart of cultural competence. Many patients feel their healthcare providers must respect and have some understanding of our beliefs, our customs, our values, our language, our traditions that are more likely to communicate freely and honestly, which in turn can reduce disparities in healthcare and improve patient outcomes, especially as it relates to opioid use disorder and the stigma around medication-assisted treatment. And so we believe that just respecting each other as human beings first, can go a long way in helping us remove some of those barriers between non-native or more Western approach and integrating and understanding Native American culture, value, and tradition.
Yep.
Next slide. So some of the cultural considerations define a Native American-based recovery program. We believe that context is important, and context and understanding the history of trauma, intergenerational trauma, is key to conceptualizing the stigma related to issues of treatment and the greatest health disparity. So for providers, we believe that understanding the historical context, especially working with tribal communities, whether it be reservation or even urban Native programming, that understanding the idea and putting it in the context of the experiences of Native people is important in helping Native people and understand and address those complex, sometimes issues around intergenerational impacts. Why we have these things in our community, why and how these things have been transmitted from this place of woundedness. And we talk about hurt people. When we look at intergenerational trauma, we also want to talk about heal people. But how do we meet there? And we believe that understanding historical impacts is important. Comfort is important. What we mean by that is non-Native providers are invited and needed to work with our Native American people. We welcome our non-Native allies, as we say, but Native patients report comfort working with non-Natives who have a contextual understanding of our history and experience in this society. So we're asking for non-Native providers to understand we need you, right? We want you in our communities, but we're asking that you listen to our people, our natives that are coming to you for help, and understanding that it helps us. We feel more comfortable when you have knowledge of those things, when you can acknowledge those things yourself and understand our context of where our trauma stems. We understand that now. There's actual research and studies that have been done to help us and help you understand that. So next, or do you want to add to that, Jerry?
I was just going to say, if you don't really have a clear understanding, it's like speaker kind of wonky. Over here, it sounds like it's getting gravelly, but maybe that's just my computer. If you don't know about what happened and what intergenerational trauma is and what the artifacts of intergenerational trauma is, educate yourself. Because it's vitally important as you work with Native people and any wounded population. So learn about it. If you don't know, find out.
Absolutely. More considerations. Communication is important. Pretty basic, right? Understandings of building rapport and the alliance that we're talking about, becoming an ally to Native communities is important, more important than the technique or the theories involved. And so especially those initial sessions is building rapport with any population is important, but when working with Native populations, and that's what we're talking about today, is building that rapport and alliance can sometimes feel more important than the technique. And I think sometimes, even myself included, in the work that we do, I can get so focused and maybe tunnel vision sometimes on the approach rather than sitting with the client sometimes and saying, I'm here to listen, being a sounding board.
Right.
Truly respectfully and being careful not to interrupt a client when they're speaking or when they're responding to questions. And we believe, and I know amongst my people, Miwek, Nisan, and Maidu, that relationships are the pillars of our culture. Like we understand the relationship we have to all things, human,
including ourselves.
Right?
Yes.
And providers, we ask that you foster a positive relationship with your clients, especially Native people.
And sometimes when we've been trained, when we're book learned and scholarly trained, and we've taken tests that make sure we know all of that book learning and scholarly stuff. And it feels like the boundaries might be slipping or that it's a little uncomfortable. It will. But I'm here to tell you, if you're not willing to flex a little bit and allow a relationship to form between you and your Native American client, there's no healing. I say it all the time, no relationship, no healing.
Right.
So you have to be willing, at least on some level, to allow a bonding, a relationship to happen and to foster that.
Yeah, absolutely. And it doesn't mean that, our education, our scholarly achievements are diminished. Absolutely not. That's not the message. The message is more about building rapport,
Right.
and becoming an ally to Native communities. And I don't want to say more important is the more rural programs, but if you've ever been to a rural reservation community and went in to do some work and recognize the disparities in healthcare and the disparities in Native providers, that's where I'm saying it's important that we have allies who are non-Native, and the disparities in education as well. So not to diminish your scholarly achievements, but to just really hit home on building that alliance, building that relationship with the community that you're serving, especially in the Native community. Because the historical impacts have taught us not to trust, right? I don't trust you. I don't trust Western medicine. I don't trust the government. I don't trust, you, the white man. And so building those relationships, rebuilding trust in those relationships, I think is vital. So having an understanding of that community is so important.
And being patient. Be patient, because it doesn't always happen the first, second, third session.
Right.
Take a while. It take a long time, actually. But it's worth sticking in there. It is where the healing will happen.
Absolutely. So avoiding excessive emphasis on getting answers to standard intake interviews. Again, like Jerry said, be patient. Patience will take you a long way in building rapport with our Native relatives. Non-Native providers, get involved in the local community and learn as much as possible about the local tribe or the urban community that you're serving. So get involved. Be proactive in being involved in that community. Learn as much as you can. Find an ally in the community, someone an elder, someone that is respected in the community, and your spirit and your intention must be pure. We do things for the right reasons, right? And we ask our clients to do those things, but we should also, as providers, be actively involved in the local community. And I think vice versa, I've done that. I've worked at non-Native programs and been proactive in the community that I've served, the dominant culture. I think that historically we've assimilated. And so what we're doing is we're just asking for that same respect in return, is to be involved. Come and sit with me at a gathering, ask for that permission. And in most cases, our relatives will honor that and respect you for that. Red Road. So some of the key concepts that we're going to talk about today, one of them being this idea of Red Road, and what we mean when we say we're walking the Red Road. We mean we're living our lives as true Native as possible. But this term Red Road isn't a new. It's not anything new that's been made up in the past couple of years or even the past decade or so. It's actually an old way of life.
Yeah, that dusty red road, we say. But following the red road for me means, as I live the red road, I'm trying to be the best person that I can be. I'm trying to live the values, Native values, relationship, of generosity, of sharing, of, there's the values are important. And
so we hear that term in many Native programs across the United States, even into Canada, walking the Red Road. About what that Red Road means is it means living a Native way of life, and it means different things for different tribes. And we're going to talk a little bit about that. And so it means walking in balance, emotionally, mentally, physically, spiritually, socially, culturally. It means those things. Medicine wheel. So medicine wheel teachings we see, and we're going to talk a little bit more about that because we're integrating the medicine wheel in the 12-step program through the White Bison organization. But not all tribes practice using a medicine wheel. But many tribes have used circle teachings or cycle teachings. Many tribes have taught that, have lived by those understandings. These teachings are designed to help us grow and maintain balance, emotionally, mentally, physically, spiritually, as we walk this idea of Red Road. It's a roadmap for life. It's what it is. It's a way of life.
And the medicine wheel can actually be that, as you learn more about the teachings.
Absolutely. So some Native American approaches, Red Road to Recovery. I first heard the Red Road to Recovery, more than 20 years ago. And Gene Thinnout's name was the one that I heard that had developed the first Red Road to Recovery program. And that Red Road to Recovery program was developed by Gene Thinnout, who himself followed those Lakota ways and developed literature and an actual program that spoke to exactly what we just talked about, walking this path of culture, of healing, of wellness, of sobriety, for many things, but an old way of life using cultural knowledge, cultural healing practices, spirituality, ceremony, and so we have to acknowledge that elder Gene Thinnout for the work that he did in coining the term Red Road to Recovery. And then we have White Bison, which was Don Coyce's vision and in his own journey of healing from alcoholism. But really, when you learn about Don and his history and the program of whitebison.org, or the organization itself, healing from historical impacts, historical trauma, intergenerational trauma, and then our own current state of the issues that we're dealing with in our own lives. So he developed the Red Road to Wellbriety program, and we'll talk a little bit more about that. But one thing that I want to hit home is that we are many cultures in one nation. So this idea of being Indian, developed by the dominant culture, kind of lumped us all into one identity as Indians. But I think it's really important that we need to understand that there are more than 500 tribes that exist today, and many more that are not recognized by the federal government that exist. And we don't all speak the same language. We don't all eat the same food. We don't all live in teepees. So that there are many, we are very diverse people, and we do identify as maybe we're one nation with all these different approaches to healing and wellness. We have a medical herbologist here. If we were saying in the old way, she's a medicine woman, right? So we have many different approaches to helping our people heal, mind, body, spirit. So this idea of Red Road, the foundation of life on the Red Road is the spirituality. This paragraph, as many as the stars in the heavens are the pathway to the Great Spirit. So all Native American treatment programs are rooted in spiritual connection, a strong spiritual connection defined by you, the client, our people, provide strength, hope, understanding, and support much more as you walk this red road. And this idea you don't have to walk the red road alone. We don't do this by ourselves. We don't have to do it by ourselves, or any program of recovery. AA and NA, they say that we don't do this alone. The beautiful thing about it is you're not alone.
Right. And as I study and learn more, whether it's politically correct or not, I work with my clients to help them define a spiritual safety net for themselves, because it's critical to healing. That you experience that concept that you don't have to walk this road alone. There's something greater than us, and those of you familiar with traditional 12 steps know that that's also important within that way of thinking about recovery. Some kind of spiritual homing device, something that will help you to feel that you're not alone on the road to recovery is very important.
Absolutely. And it's really, I mean, at the core of Native culture is this idea of family, right? And this idea of family is supposed to be this place where we belong, where we feel connected, loved, nurtured. Uh, and so this idea of recovery and healing from a Native perspective should be this place where we feel like we belong, like we feel connected to. I feel safe here. And so this idea of Red Road and spirituality, especially integrating into treatment programs, is this place that's supposed to provide those beliefs, those feelings of safety,
Mhm.
hope, understanding, and I don't have to do this by myself. I have support. So, next slide, please. Some more Native American approaches, the White Bison Red Road to Wellbriety. So what the White Bison program offers includes culturally based curriculums. The Medicine Wheel and the 12 Steps course has materials, workbooks, video components. Don Coyas himself, along with a team of a council of elders and other folks, non-Native allies, have helped develop these materials and these videos based on Don's vision of a well, sober community. So wellbriety means living well, sober. It transcends just being sober. It means that I'm going to work on all parts of myself using these medicine wheel, integrating the 12 steps of AA, which is a very powerful concept when you are trained to understand the medicine wheel and how the 12 steps was integrated, and really the history of both. So this idea of Red Road to Wellbriety isn't new. I mean, Native American healing goes back thousands of years, but healing from alcoholism goes back probably about 400 years. And there are histories that we have learned from Chief Ganondayo, Sick Nation Iroquois, they call him Handsome Lake, who utilized Native American culture when he recognized amongst his people alcoholism was rampant. It was killing our people even in those days, and developed a program based on his own experience where he was detoxed in a ceremonial and experienced spiritual experiences that we have to get rid of this poison, alcohol. So this isn't new. This goes back
One of
years. When we talk
my part of friends once told me they don't call it spirits to nothing, the alcohol. When you see a store where it says wine and spirits, be careful because it's a bad spirit.
absolutely right, spirits are alive. They're breathing.
Yeah. It's interesting that alcohol, that's another name for alcohol, is spirits.
Absolutely. Some of the other courses that White Bison offers is Mending Broken Hearts, which is, again, it's curriculum-based intervention addressing historical and intergenerational trauma, specifically grief, unresolved grief, and loss in recovery. A very powerful program. We're actually facilitating that right now here at the Native American Health Center in Sacramento. A Warrior Down recovery coach materials. Warrior Down is another program that assists men and women coming home from incarceration or residential inpatient treatment. And it's a program that really helps develop a reentry component to your program. The Red Road to Wellbriety, the textbook itself in the American Way, also is another program. And White Bison actually has developed programs for use for adults and youth. And so they have programs, Sons and Daughters of Tradition. They have programs, Mothers and Fathers of Tradition, Families of Tradition. And so we can talk more about that as well. Next slide, please. White Bison's also developed what they call is they've certified recovery facilities, and you can become a certified White Bison program, and some of the things that are offered when you become a certified well variety program is employing at least one individual of Native American ancestry, and we believe that's important in recovery for many reasons. But one of them is that when a Native client comes to your program, there's research and study that shows that the effectiveness of a Native counselor with a Native client who understands, has knowledge of their traditions, their cultural practices, maybe their language, and their ceremony and spiritual path. And so we believe that having a Native, at least one in your program, is beneficial. Another, provide individual counseling for those Native American clients. And I think across the board in every program I've ever worked in, individual counseling was very important, whether it be mental health or SUD counseling. Provide access to Native American elders. So elders are important, highly promoted in the Well Variety program. And hopefully that elder has knowledge of the spiritual, cultural, and can provide those teachings, ceremonial teachings. Incorporate traditional Native American healing practices, smudging, roundhouse, sweat lodge, or whatever that is for the tribal community you're working with. I'm really open to someone like Sage Lapina, who offers medical herbology as an approach. Invaluable. Establish aftercare plans by providing community referrals and continuous self-care. Those are important and vital to maintaining well variety or sobriety. So having an aftercare plan that is connecting them to the community they serve. And once you develop those resources and those relationships in those communities, and ensure all counselors are trained and incorporate some level Native American approaches to healing and wellness or addiction recovery. Next slide, please. So some more Native American approaches continued. Telewell Indian Health in our MAT program is one. MAT can also be referred to as MAR. And I want to acknowledge Dr. David Springer, amazing man, been working in Native communities for many, many years, decades. And at Indian Health is where I first met him, as his vision of Telewell Indian Health and this MAP program. We talked about this idea of MAR, medication-assisted recovery, which when we looked at other programs that have existed in terms of medication-assisted treatment, what was missing in many cases was the recovery components, connecting folks to a plan of recovery, like the medicine wheel and the 12-step program, because historically what we see, and we talked about stigma in previous presentations, and I was involved in a webinar yesterday that addressed stigma briefly and the importance of culture integrated into MAT programming is stigma towards folks who are receiving MAT services. And so this idea of medication-assisted recovery for folks involved in MAT programming, I think, is invaluable when we can connect people to each other in a setting that is conducive to safety, belonging, healing, and ceremony, spirituality, and recovery. And so this idea of implementing MAR at MAT, I think, is going to be invaluable. One of
I just, if I can say for a second, Albert, one of the things that MAT, medication-assisted treatment, or MAR, medication-assisted recovery, as we look at that, what it requires of us as providers is to kind of question our own definition of what recovery is. Do we support only an abstinence model, especially for our people who are dependent on opioids? That has shown that it doesn't work. there's a 90% relapse rate among those programs that are not medication assisted. So harm reduction, which for some folks is kind of a dirty word in the recovery community, but really this is harm reduction. And if it saves the life of somebody who has the disorder, wouldn't we want to do that? You know, I know if I look at my loved ones and relatives who have overdosed, if you ask me, would you rather have them clean, absolutely abstinent of opioids, or here and maybe using medication-assisted treatment? I know what I would choose. So this is kind of our passion, our mission right now at Tellwell is to get the word out that a shift in our paradigm, a shift in our thinking about recovery and healing is going to save lives. And there's lots of data to support what I'm saying. And I just wanted to get that out there. But to that end, and as looking at, you know, covering all of the pieces for Native people that are important, Albert and I are going to be offering, sponsored by Tellwell Indian Health, a new program that's actually, it's a little baby because we just birthed it. And we are putting together the elements of it and how it's going to work now. But it's going to be a virtual Red Road. People can get access to their program, to their meetings, to their healing modalities online. So do you want to say more about that, Albert?
Oh, yes. Spirit of Healing, a virtual Red Road journey and online program for Tellwell Matt. So what our vision is to offer a telemedicine approach for the White Bison Medicine Wheel and 12-step teachings for those communities, the rural communities that Tellwell Indian Health is contracted with to provide those folks who may not have access to a Red Road meeting in their community, or someone who has knowledge of the medicine wheel and the 12-step approach, that they could join in from a remote location and be a part of a virtual Red Road meeting, different from an online meeting, because it'll be a closed meeting for those clients who are patients of Tellwell Indian Health. So it'll be a confidential meeting, and they'll be able to follow the medicine wheel and the 12 steps as Jerry and I navigate them on this journey of Red Road. And it's innovative. So we presented at, Dr. Springer and I presented briefly, we did an hour presentation at the White Bison National Conference a little more than a week ago. And we presented this idea, and we didn't have a lot of people in the room, but the majority of those folks in the room had not experienced or heard of a virtual Red Road program. White Bison itself is the only other program that I know of, and I've done some research across the United States, calling programs around the country, and no one is implementing a Red Road version besides White Bison. And they offer an online meeting using a format that's called In the Rooms. And every Thursday, 6 o'clock our time here in California, you can access a virtual Red Road meeting, a Wild Variety meeting. But other than that, I don't know any other, especially at the program level, that's offering that at this time. And so with Tellwell, where I'm assisting with developing that program. A virtual Red Road experience, Spirit of Healing. And so some of the other...
yeah, at this slide, I don't know what happened to, but it's half cut off.
So it's just really identifying more programs out there. And we talked about inpatient, outpatient, you know, sober living programs. And so here in California, we have urban Indian health centers across the California. And SUD, which is the California Consortium for Urban Indian Health Centers, is actually a nonprofit organization that is an alliance of those urban Indian health organizations and other substance abuse treatment facilities, collectively referred to as UIHOs. And so what their role is to really bring those programs together and really assist in developing programs to address different issues, health issues, and specifically around substance abuse treatment. And I know specifically many of the relatives that are doing that work, great people, folks who have been working in our communities for many, many years, highly educated, well-trained, and experienced and knowledgeable in their own cultural practices, who are developing opioid use disorder programming. They're MAT champions as well. And so I applaud the work that they're doing. You could reach out to SUD. They have a website, and you could reach out to them to learn more about their programs and the services that they're offering by way of opioid use disorders. But moreover, the work that they're doing in Native communities. And there are several residential treatment programs in our area, some that many of us are familiar with in our areas that we have relationships. There are many across the United States, if you want to do more of the research on programs across the United States. But here in our area, we have the San Francisco Friendship House, which is an amazing program that uses culturally based interventions as well as Western approaches. And they integrate those. And they're a 80 bed facility, 40 men, 40 women, and they have an amazing staff. Helen Wakazu is the CEO, an amazing woman with a powerful story of healing, wellness, and recovery. And her and her husband, Marty Wakazu, brilliant in the work that they've done over the years to help our communities heal. You have Turtle Lodge in Fresno, California, that they've been around for many, many years. They've done great work in the community there. We do offer referrals there from time to time. And you have the Tule River Trap Program. That was a vision of one of their elders that was crossed on to the spiritual realm, that program is still in place. And we do have contract with them, and we utilize their services from time to time. And then here in our area, we have the Manteca Native Directions Program. Ramona, an elder who I have a lot of respect for, we otherwise know them as Three Rivers Lodge. And so those are some of the programs that in our area that we're familiar with. And I'm sure there's some that I missed that are not on there. That I, just want to offer, that they utilize culture as the foundation to the program. Native American ceremonial practices, some culturally based interventions, as well as integrating Western approaches and allying with those relatives, who have knowledge of healing, wellness, like Jerry Shea, Dr. David Springer.
Thank you.
Who have skills, who are native themselves or non-native, and we can come together and sit and offer treatment for our people. Of course, I work at the Sacramento Native American Health Center. That's my full-time job. We have an amazing team of folks led by Britta Guerrero. She has put her heart and her soul into those programs as well. There's one that I want to promote because I really have a lot of respect for this motivational interviewing approach for Native American programs, and it's called Weaving Native Practices and Western Practice. And we talk about this integrated approach. You take a look at that, and that's the name: Motivational Interviewing for Native American, Weaving Native American Practices and Western. The very powerful approach at motivational interviewing. There are some of the relatives that have developed this program. Camilla Venner, PhD, she's Alaska Native. Sarah Fieldstein, who's an amazing person herself, and they work for the Center of Alcoholism, Substance Abuse Addictions. Department of Psychology for the University of Mexico, and Nadine Tafoya, who's a Mescalero Apache, who was also a part of developing this approach, motivational interviewing for Native Americans. Very powerful approach.
And where can you find that? Are there workshops in this, Albert, or?
Well, they actually have a curriculum, and you can type that in. You can Google that, and their curriculum will come up. And I believe it's a free download. That's how I found it years ago, and there wasn't a training associated with it that I attended, but just reading through and having understanding and being trained in motivational interviewing from a Western approach, and then reading through this curriculum that they developed was very powerful. It just made so much more sense. And almost, we already are offering that. So one of the things that I also wanted to add, I don't know if there's another slide, Jerry.
I think that may be the end.
Yeah, that may be it, because I know we're close to being out of time, and I want to start to open it up for questions and responses. But also, I wanted to add that
we're at the end.
We're talking Native American approaches, and this idea of integrating to Western practice is that many of the modalities, the theories, and other approaches that I learned in Western training, and I'd say motivational interviewing being one of them, cognitive behavioral interventions and therapies, dialectical behavioral therapy and interventions, and the list goes on, have components of our cultural, spiritual, ceremonial practices. They're embedded in that, and spirituality being at the core of many of those.
Yes, very much so.
Mindfulness, grounding.
Cognitive therapy, and that we create our own reality by what we believe, our beliefs about things, color, the way that we walk the road, the way that we see the world, and we can change the way that we see it and feel about it, and it will change our experience of life. We create our own happiness or our own distress, and how we choose to see things. I know that sounds a little hokey, but it's actually at the root of Native thought, especially for my tribe, for Cherokee.
Some of the programs that we outlined, the inpatient residential programs, many of them use sweat lodge ceremony. Many of them use drum circles, drum teachings. And there are research and study on drum therapy that exists in Western institutions and trainings. So we know that there is some substance to our cultural practice and healing pathways. So we know that exists anecdotally, right? One of the things when we talk about historical and intergenerational impacts that I've said is the proof is that we're still here. We survived genocide, and we're still here. We've integrated, we've acculturated, we've assimilated.
So we've done something right.
And here we are, many of our elders who survived and kept our languages alive, kept our ceremonies alive, kept the teachings of the next 7 generations alive with their prayer, with their resilience, with their hope. It is powerful. And here we are, we get to sit and we get to have these discussions because if certain parts of society had their way, we wouldn't have these things.
Our ancestors had very refined coping skills.
I have a relative, a brother, that years ago we would talk, and we talked about this idea of healing and wellness and transcending being clean and sober, because we're recovering so much more as Native people. We're recovering our language, our songs, our ceremonies, our way of life, our foods, right? Food sovereignty is huge now. And and we talked about this idea. It's like, if you really sit and think about it, because we were sitting in a circle, we had an altar, we had our medicine, we would sit in a circle with youth, and that brother's Calvin Hedrick, and we talked about, just think, had our ancestors, those elders, not kept these things alive, they were meant to be wiped out. And so the beauty of it is we have programs available to help our people heal, medication-assisted treatment, medication-assisted recovery, and we don't have to be afraid to use them. As a matter of fact, it's beautiful, it's powerful, it's healing when we can come together. This idea of integration, it really just means we can all come to the table, respect each other, respect our knowledge, respect our practice, and respect each other as human beings first, and share our gifts and knowledge to help the people that come to us for help. Very powerful.
Well said. Are there any questions? Any comments? No? Should we finish it here? All right, if there are no questions or comments, I can be reached at g.shea@tellwell.org. If anybody would like to contact me by email, that would be fine. Okay. Are we finished?
If there's no questions, you know, I just want to acknowledge anyone that actually sat for our webinar today. Thank you for sitting for our webinar.
Yeah.
Hopefully we were able to at least spark conversation or interest. And if you have any questions, you can reach me also at a.titman@tellwell.org.
Okay. Have a blessed day.
Thank you.
Take care.